carry on. So now we're going to look at the last trimester, trimester number 3. So looking at trimester 3, generally it's from 29 to 40 weeks. Of course, if a baby is a little later, it might be 41 weeks or even up to 42 weeks. Here I've written the 6th to the 9th month, but generally, as I've mentioned, I don't use months as an indication because weeks are much more accurate. So looking at the symptoms, signs and symptoms of the 3rd trimester, so weight gain is generally there to some extent. A little bit is going to be there, and there's going to be decreased energy and fatigue for some women. But remembering that it is not all women who will have decreased energy. They can have decreased energy because it's getting a little bit harder for them to move around. The baby's taking more efforts, you can say, or the body is taking more efforts to be carrying the baby, especially for a woman who is carrying a very large baby. It might be a little bit more difficult for her because think of carrying around a big sack all the time. It can get heavy, so it can be a little tiring for some women. Of course, it does depend on their background as well. So yes, some women will feel more tired, but others will feel more energy because basically they're excited to see baby, and so all of that excitement is keeping them full of energy and prana. And of course, yoga can help a lot in keeping the energy levels very high. So next, looking at frequency of urination. So generally it's going to be increasing in that last month or two when the baby starts to move down. So you might have been aware of, a baby, or the shape of the belly you can see in pregnancy is fairly common. And then in that last month, the shape of the belly changes a little, so the bump becomes lower because the head is come further down into the pelvis, and it's called engagement of the baby. So basically in that last month, many babies will move down and the head will go in that pelvis, and there's usually it's called like 2/5 engaged or 3/5 engaged. Usually baby's not fully engaged until that time of labor, but baby will start to move downward, and that's where she can have a lot of pressure being put onto her bladder, which can make it a little bit more difficult. I'll tell you a short story. A friend of mine, she put on quite a lot of weight, more than 20 kilos, and she was a small girl. So she said every time I moved, I just peed just a tiny bit, because there was so much weight there, the pressure of the baby, and she did have quite a big baby in the end. So that pressure being put onto her bladder all the time, she just couldn't cope up, and she wasn't doing regular pelvic floor exercises either, which of course are going to be helping. So yes, urinary frequency can be there. Then the movements of the baby are generally going to be much stronger. Usually they are going to be intensifying in strength throughout the pregnancy. Of course, how much movement is there can vary because once she gets into that 3rd trimester, there's much less chance that baby's going to really be moving around a lot because the baby can't actually turn very easily at all. And if baby does turn, it's quite strongly uncomfortable, but baby will still be doing a lot of kicking, a lot of elbowing, punching, all this kind of thing is going to be happening even if baby's not fully turning around. And generally, yeah, baby won't be able to turn around, and you don't really want baby to turn around if the head is already down. So vaginal discharge can be there in the 3rd trimester. That discharge is going to be changing closer to the time of labor, and we'll talk more about that later on. Difficulty in balancing can be there, of course, because that center of gravity is changing, the belly is getting larger. So a lot of these symptoms that we're talking about now, we've also talked about in the second trimester, because some women will start to have some of these problems in the second trimester. Difficulty sleeping. So difficulty sleeping again can be because of position, not being able to find a comfortable position, but it can also be because of thoughts, and especially when it's getting closer to the time of labor and delivery, she can be worrying and thinking about that a lot more, and we'll talk on that too. So that kind of thing can be keeping her awake at night. Constipation basically because there's not a lot of space there for the digestive system to be working as efficiently. So she might find that it is rather on the sluggish side. Increased heartburn, so that's very common in the third trimester especially because that space is decreasing. There's a lot of pressure being put onto the stomach, and so the acid can definitely be coming up. Indigestion flatulence, yep, that can be there as well. Breast enlargement, yes, and especially getting closer to when baby's going to be born. Headaches can be there just because of the hormonal changes, and also because of an increase in pitta. Faintness and dizziness, like before, especially if she's got very low blood pressure, then it's highly likely that can happen. Nasal congestion, bleeding gums, yep, increased appetite. So for some women, they do have that increased appetite throughout their pregnancy, or for some of it. That varies a lot depending on constitution as well. But you'll see here it may decrease in that last month. So some women don't feel very hungry in that last month, and many women also don't put on much weight in that last month at all. Food cravings and aversions can be there for some women. Fluid retention can be there, especially if the blood pressure is getting a little high, then fluid retention is much more common. And here you can just have a look at the picture, so you can see the uterus, and you can see how the uterus is growing and expanding with each month. And just looking at that makes you think, wow, how amazing is the body that it can grow from such a small size, like an orange or even a mandarin, to like this massive, very massive size that can fit a 9-month baby inside, well, a fully developed baby. So yeah, it's amazing what the body is capable of doing. And you can also see here after dropping, so you can see when the baby drops down, how the shape is going to be changing. And for some people, they can tell very easily, like if a baby has dropped, and they go, oh yeah, baby's getting ready to come, because the shape of the belly has changed in that. Varicose veins can be there, hemorrhoids. Shortness of breath is definitely more common in the third trimester, again because of a lot of pressure from baby. Of course, when baby drops, often that shortness of breath starts to go. Achingness of the belly, as in the second trimester. Itching of the belly is still pretty common because the belly is still stretching. Leg cramps, back pain, sciatica, rib pain. We've already talked a bit about urinary incontinence and clumsiness. So all those things can be there for some women. Most women are not going to have all of those, of course, but they may have one or two. Then Braxton Hicks contractions. So that is more specific to the third trimester. So basically those Braxton Hicks are like a preparation for the body for labor. So where there's going to be a contraction of the uterus, and there might be many contractions of the uterus, the Braxton Hicks. Some women, when they feel that, they think, oh, I'm in labor, and they go to the hospital, and then they just get told, oh no, you've got to go home now because it's not real labor. It's often, known as false labor. So basically, when we're in real labor, the contractions are going to be rhythmic. And with Braxton Hicks, it might be that she has one, then she has another after 5 minutes, then she has another after half an hour, then she has a couple of hours and she has another one. So it can be very irregular. The severity of the Braxton Hicks can change a lot too. For some, it's just going to be very, very mild, but for some women, it can actually be a very strong uterus contraction as well. So that can be there. Not all women have Braxton Hicks either. Some women don't have any at all, and some women have them very, very frequently. Then leaking of the breasts. So that is definitely more specific for the third trimester. Some women do have leaking earlier on, but it's definitely not as common. So the leaking of the breast, so the milk hasn't come in yet. Instead, it's a type of golden fluid, you can say. Liquid gold, they often call it. So this liquid is known as colostrum, and it is the first food that the baby is going to have, and that's the first couple of days that colostrum will be there, and then it will become milk. The milk will be produced. So the colostrum is known as liquid gold because it's so important for the baby to have that liquid. There's very, very important vitamins and minerals that are necessary for baby. And you know, it's said in that if a woman isn't going to be breastfeeding, at least she can give the colostrum the first couple of days to give that support to the baby. So it's really, really important for the baby, but we'll talk a lot more about that in postnatal. But yes, that is the liquid that's going to be leaking for some women. For some women it won't leak, but if they squeeze the nipple, then that will come out. Heaviness of the abdomen is again very common, of course, because baby's getting larger, and especially when the baby drops, there can be a lot of heaviness and pressure being put into the pelvis. And some women talk about their baby when it's becoming engaged, when baby's dropped, like walking with a bowling ball between the legs, because it's so kind of uncomfortable with that hard head. So that can be there. And so yeah, difficulty in walking. So here you can see just the picture of 32 weeks and then the size at 40 weeks and how it looks. So continuing with some of the signs that will be there, so forgetfulness, decreased concentration, it's pretty common, increased thoughts of childbirth. So, you know, as a baby's getting larger, and the time is going on and she's starting to think about the due date, or she's, you know, getting to 37 weeks and she's thinking, oh, baby could come anytime now. So those thoughts are going to be there, and there can be all sorts of thoughts going on. Some of them can be really positive thoughts of excitement, but then there can also be fears, anxieties, apprehension, you know, worries about childbirth, all the what ifs. So yeah, there's also going to be worries and anxieties just as the baby will be okay, healthy, safe, like with the whole 9 months. She might be dreaming more about the baby as well. It's very common. Lots more thoughts about baby. Interestingly though, most women in pregnancy, they can't really picture the baby outside. They can visualize baby inside. They might be able to visualize the time of childbirth, but it's often hard for them to visualize past that. So more thoughts about baby. For some women, they might be getting really bored being pregnant. You know, some women aren't very happy or very comfortable to be pregnant. They can be quite impatient about it, you know, that waiting the whole 9 months before they get to see their baby, especially if it's been a really long time that they've wanted to have a baby. And that's where also a lot of women decide to have interventions just because they want to see the baby earlier. And we'll talk more about this, but a lot of the time a doctor may say, oh, okay, why don't we just do a elective C-section cesarean, then you'll get to see your baby. Oh, why don't we just start an induction? You know, you're 37 weeks now, that's okay, we'll start an induction. So many women, they don't know any better. They just think, oh yeah, I really want to see my baby, so I may as well just do one of these processes to make it faster. But of course, they are interventions and they can lead to all sorts of other complications. So it's always better to let baby stay in for as long as baby needs to be there. Eagerness can be there for the pregnancy to be over, especially for a woman if she is having a lot of problems. So, if she is having like a lot of back pain and she's not able to get comfortable, she's not sleeping, it might be that she's very excited for the pregnancy just to be over. So excitement that the baby's coming, of course, that's definitely going to be there. Relief for some women, that it's almost over. Like imagine, for a woman who is having nausea and vomiting every day for 9 months, definitely there's going to be relief, when she has her baby. So that can be there. Of course, a lot of women also love being pregnant and they're not really ready for baby to come at any point because they just love being pregnant. Oversensitivity to others' opinions. So this can be there. It can pretty much be there for the whole 9 months, but in the last trimester, it can especially be there related to birth because a lot of pregnant women will find that others like to have their opinions. They like to tell their stories of birth, usually the negative ones. They want to talk about what you should be doing, what you shouldn't be doing, how you should be looking, so all these kind of things can make a woman feel uncomfortable, or she might be just feeling very anxious, or she just doesn't want to hear other people's opinions. So that can definitely be there. She might have impatience and restlessness in that last month. It's just like a waiting game. Those last couple of weeks, especially when one doesn't know exactly when baby's going to come, because you never know unless you have a planned cesarean. You never know exactly when baby's going to be there. So it is kind of a waiting game, pretty much from the 37th week all the way up to whenever baby comes. So she might be just having a lot of thoughts in that way. Fear of birth is definitely one that becomes stronger as it gets closer to that time. And now looking at the baby. So here you can see a little picture of an ultrasound there. So by 32 weeks, the baby is about 41 centimeters long and weighing around 1.8 kilos. The baby is inhaling the amniotic fluid to exercise its lungs and it's practicing breathing. And by 36 weeks, the baby is about 47 centimeters and 2.8 kilos. And by the end of the 36th week, the baby is classed as full term. So that means that it can be born anytime from then on and it's not classed as premature. So from 37 weeks. But obviously most babies are going to be born a little bit later. So generally they say 40 weeks is the due date. But as you can see, only 5% of babies are actually born on their due date. And the baby might be 50 centimeters on average and about 3.2 kilos. Now, it is very, very common for babies to be born later. So on average, a baby is born at 40 plus 8 days. That is considered the average for the first baby. And second baby is 40 plus 3 days, so 40 weeks plus 3 days. So that's why you also see that in some countries they say that baby is the due date is at 41 weeks instead of 40 weeks. But basically there's a period of around 40 days where it's considered normal for baby to be born. So we can't have a fixed idea in our mind of when baby has to be there because, baby also chooses its time to come. So looking at what is important to remember in the third trimester. So taking care with squatting positions. So squatting positions we use as preparation for labour, we use them in labour, and we may use them when we're up to 40 weeks and we're ready for baby to come out and we don't want to have some kind of artificial induction. So we start doing more squats. So squatting is definitely really helpful, but if there is chance that baby's going to come early, if her cervix is starting to dilate, if she's had any kind of bleeding, if she's got placenta previa, if she has a stitch, they're all reasons why we would want to avoid squatting. Generally, we don't do lying down, so lying down flat on the back because it's uncomfortable for most women. So laying on their side or laying at a 45-degree angle is a better option. Then avoiding anything that is causing discomfort. We do this anyway, but definitely there's going to be a higher chance in the third trimester because she's a little bit larger, she's a little bit more delicate, you can say. So certain positions that she might have felt really comfortable to do in the second trimester, she might not want to do them in the third, or she might want to take a variation of them. Then for asanas, definitely the belly is going to be getting larger, so you need to have more space for the belly. So for example, for some women, they might have been very comfortable to do Shashankasan with the knees apart and put their head on the ground, but then the belly's getting larger, so now they can't have their head on the ground easily, so they might need a bolster or a chair or something to be able to relax, or they just keep their arms straight. So there's lots of ways that we can create more space for the belly. It might be that we're doing a side shavasana, and because the belly's getting larger, we just prop a couple of bolsters or a couple of cushions under the leg to make it a little easier and to have that space. So there's going to be a lot more adaptation of yoga poses. So often doing easier variations instead, and generally not holding them for as long unless it's really, really restorative and comfortable for her to be in. So using more bolsters and cushions as needed. And if we don't want to use bolsters or cushions, or we don't have them, then we take other variations or other poses that are going to be more suitable. So looking at the specific yoga practice, our focus of our practice. So again, we want to look at balance. So physical balance and also mental balance. And the balancing poses are actually really nice to do in that third trimester because she can feel really, really heavy. And when she does a balancing pose, it just makes her feel really light. So you don't have to get worried about doing balancing poses in the third trimester. Definitely she can be doing them, but it might be that you want to use a wall or you might want to have a chair. You're not going to go and do some kind of advanced balancing poses, but doing something like the tree pose or Patangasana, the kite pose, and using the wall as a support can make her feel really, really good. And aqua yoga is actually really good for this as well, especially in that third trimester. Aqua yoga can be really amazing for a woman and how she's feeling. So we also want to have a lot of relaxation, more restorative practices. So especially if she is feeling lower in energy, we want to do practices that are going to energize her and make her feel really good. We also want to do poses that are going to prepare her for labor. So they might be poses that she is going to work on that she can use in labor, or they might be poses that will just make it easier at the time of labor. So it might be that, okay, she's going to be doing cat pose a lot. So before that, we do a lot of preparation for the wrists, for the knees, so that she'll be able to be in that cat pose for however long it takes, possibly even a couple of hours. So preparation for labor is going to be really important, and not just with poses, but also with relaxation, breathing, and so on. And then the last point here is introversion. So it definitely is a time where she should go inwards a little bit more. Naturally, it happens for women in that last couple of months because they know that there's going to be a lot of change that's going to occur when baby comes out. So generally, they are very much happy to go inward a little bit more and be quiet. So there's a lot of practices that we can encourage her to do, which will help her to have more of that introversion. And it also brings that introversion brings a lot of calmness before the craziness of, birth and a newborn. So looking at the yoga practice specifically, so looking at the asanas, we want to do asanas that are going to be strengthening the legs. So strengthening the legs in preparation for things like labor and then also postnatally. We want to continue with the gentle pelvic opening practices, but not too strongly, okay? Unless baby's late. And a lot of relaxation should be there too. Looking at pranayam, we want to do pranayam for labor preparation, so being able to breathe more efficiently and also to stay focused, to stay relaxed. We want to do pranayam for introversion as well. In fact, many women really, really love to do pranayam in their last trimester. Many women in the second trimester, okay, they like it, but they're not as excited about doing it as they are in the third. And also for balance of mind. So especially if there's a lot of fears or there's a lot of anxiety or stress, then the pranayam is of course going to be really, really helpful for that as well. Then she can be doing meditation, and especially she can do like birthing meditations, which will be really helpful to overcome any kind of fears or anxieties that she's having. She can also be doing mantras. So especially is going to be really helpful for her mind, especially if she is having a lot of fears. It is a little on the introverting side as well. Mahamrityunjay, of course, is for health and healing, removal of obstacles. So that is also a great one for her to be doing. Generally, we don't do as much Gayatri in the last trimester because she often has more of those heating issues like heartburn and things like that, and Gayatri is known to be a little too heating. Of course 11 rounds of Gayatri is not a problem, but if she's going to do 108 or if she's going to do a couple of malas, it's a little bit too much of Gayatri. But Mahamrityunjay and Om, she can do as much as she likes. And then we've got Yoga Nidra. So in the Yoga Nidra, one can also have a visualization of birth. And of course, Yoga Nidra is different to meditation because when we do Yoga Nidra, we're kind of in that half sleep state, that in between sleep and wakefulness. So all sorts of things can be put into that. And of course, she needs to have lots of relaxation as well. So yeah, encouraging her to be doing yoga nidras, different forms of side shavasana that she does. Her pranayams, of course, are going to be relaxing. Her asana practice should also be very relaxing too. So she can do all different things in her third trimester, just remembering that her body has changed even more, and generally she is going to be slowing down a little bit. So that's about our third trimester. And next we'll be moving on to labour.